Health officials have been warning people to stay out of floodwater, and there is a new reason to be concerned. Testing has reportedly shown different strains of COVID in the water. WSAV's Tyler Nicole asked a doctor how likely it is to catch COVID this way.
We've all seen the warnings about floodwaters and the risk of infection from viruses that come with it. The CDC's updated wastewater map shows high levels of COVID-19 in our area. But what are the odds of transmission?
Wastewater is usually a means to measure how much COVID-19 is in the population, more so than a huge risk of getting COVID-19 from the wastewater. Because it's a virus and spread with respiratory droplets, it does survive to some degree in wastewater, and that is a risk, but it's a low risk.
Dr. Connolly says there has been an increase in COVID numbers this summer, and that tracking the wastewater helps doctors to know what viruses to test for when patients come in presenting symptoms.
So we know that there's a big increase in parvovirus B19, for instance, in certain parts of the United States. And again, they can measure certain viruses in wastewater by amplifying the viral DNA or RNA and looking at how much there is. So as we see the COVID go up in the wastewater, we know as doctors we need to be checking people more often for COVID when they come to the hospital sick, because people present in different ways.
Dr. Connolly says prevention can only go so far, but hand washing and staying home when you're feeling sick can lessen the spread.
Prevention is good. Being a healthy individual at baseline is perhaps the best thing you can do, because almost everybody, if you haven't already, is going to get COVID, and almost everybody's had it, whether they realize it or not. But if you're healthy, the vast majority of the time you're going to do just fine and have minimal symptoms.
The 2024-2025 Moderna and Pfizer vaccine was just approved by the CDC yesterday. Dr. Connolly says it may take a few weeks before it will be available to the public. Tyler Nicole, WSAV News 3, on your side.